Hi, thanks for joining me for another episode of Ask Kate with me, Kate, brought to you by the Children's Tumor Foundation. Today, I'm going to talk a little bit about what it means to live with NF as an adult. Now, quite often, our name, the Children's Tumor Foundation, is a little confusing to patients, and I frequently get questions about whether or not we actually work with or advocate for adults with NF. So the answer to that is absolutely yes. The reason for the name has nothing to do with a special focus on children. We understand that NF is a lifelong condition that impacts people across the lifespan. Some people are diagnosed in childhood, others are diagnosed much later in life, and everywhere in between. And so the Children's Tumor Foundation is dedicated not only to advocating for and helping fund research for children living with NF, but also for adults. So to that end, I wanted to do a little video about some questions that I frequently get that focus primarily on what it's like to be an adult living with NF. So the first question that I get a lot is when people are having difficulty working. Their NF impacts them in such a way that holding down a job is really difficult. So I often get questions about applying for disability. So NF1, NF2, schwannomatosis, by themselves, these are not conditions that are recognized officially by the government as qualifying you for disability. So what I tell people is that the most important thing you can do is to work with your doctor to explain how NF is impacting you. So is it causing chronic pain? Is it impacting your mobility? Does it impact your ability to learn or to think quickly or to make quick decisions? Does it impact how you interact with others, cause chronic migraines? There are any number of ways that living with NF can impact your ability to work. And so it is important if you're applying for something like Social Security, disability, etc., that you work with your doctor on explaining not just that you have this condition, but how it specifically impacts your health and your function. Another question that I get a lot is about pain in NF. Now, children living with NF also experience pain, but we do see this more frequently described in adults. And so I wanted to just take a quick moment. I could never cover everything there is to say about this topic, but I wanted to highlight that about 6 months ago, we did a video with a wonderful researcher, Dr. Vrancianu, who was doing some really innovative and cutting-edge research on the idea of resiliency. You can see that video and see everything that she talked about on our website under Ask the Expert, and we'll include a link to that with this video down below, and you can learn what she's talking about. But resiliency is this really fascinating idea that says that our brains actually have some flexibility, and that when it comes to trying to understand and cope with our lives and our situation, that we can actually work with our brains and retrain our brains a little in order to improve outcomes, improve the way we're feeling, and things of that nature. So when it comes to pain, this can be a really powerful tool because often we can't change what's causing our pain. Maybe that tumor cannot be removed, that headache cannot be treated effectively. And so there are things standing in your way that you don't have control over. And resiliency can really help us to work with what we do control. And so there are lots of different methods that Dr. Vrancianu describes, and she shares about her research there. So I would encourage you to go and check out that video because it can be a really powerful tool in how you manage and deal with pain. Now, the next thing I want to talk about is finding a doctor when you're an adult with NF. This is a really unique challenge. For reasons that are complex and would be too difficult to explain, we understand and we do know that there are more options for children with NF to see a doctor that understands NF than there are for adults. Children also, if there are issues with health insurance, children in every state in America at least will qualify for government-funded health insurance. This is not true for all adults. If you can't get qualified for disability, if you cannot get on Medicaid, Medi-Cal, depending on where you're living, then it can be really difficult. And so I want to just talk for a brief moment about the fact that we understand that at the Children's Tumor Foundation, and we are working really hard to expand our NF clinic network to try to increase the accessibility of these great doctors. And we're doing that in a lot of different ways, including opening up new clinics, but also some more creative things where some of our experts who are located in one part of the country possibly could work with doctors who are willing to learn in other parts of the country. So that's something that we understand is a real issue. So to that end, I think a really valuable resource for adults with NF is your own ability to understand your condition and to advocate for yourself. So if you are an adult and you're living with NF and you're seeing a regular doctor whose understanding of your condition is pretty limited, then you need to understand your own condition and how to advocate for yourself. And I have talked to so many incredible adults living with NF who are doing exactly that. And it is amazing. They probably know more about it than I do, and definitely than a lot of their doctors do. And so I just want to encourage you to educate yourself and to use our resource library, download those brochures, learn about the condition, know what questions you're going to ask, take a notebook with you with your questions written down, and make sure that you get answers that make sense to you, and keep asking until you get those answers. Also, reach out to me. I'd love to be a resource for you. I'd love to help you think through how to approach your next appointment with your doctor, how to ask for what you think you need. These are important things. Like I tell parents about their children, this is true for adults too, that you are an important part of your medical team. And you need to feel empowered and able to really participate fully in your own care. Okay, well, hopefully this video really generates some questions, because I know I've probably just barely touched on all of the different ways that living with NF as an adult can impact you. So I just want to really encourage you to leave a comment or email me, because I would love to do a follow-up video to answer more questions so that we can continue this conversation. Thanks so much and have a great day.